Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers. Today, a look at the CDC's Injury Center, which for more than 30 years has studied the science of injury prevention and made recommendations on everything from speed limits to car seats to swim lessons to keep people safe. With federal funding cuts and the center's budget on the line, injury prevention expert Natalie Draisin talks to Stephanie Desmon about why the center is crucial to strides made in saving lives. Let's listen.
Natalie Draisin, thanks so much for joining me.
Thank you so much for having me. It's a pleasure to join you.
You work in injury prevention, and I wanted today to talk to you about the future of injury prevention. And I guess maybe the best place to start is the history of injury prevention.
Absolutely. So the history of injury prevention is an interesting one. Injury prevention was really seen before as something about accidents that were acts of God. They were not preventable. And then there were a couple pioneers that really changed that, and they saw them as preventable, and that was revolutionary. So specifically, I'm going to tell you about the CDC Injury Center because it's at risk, and we have a chance to save it. We have to save it, quite literally, to save ourselves. It focuses on the leading killer of people ages 1 to 44, and that's unintentional injuries. And what I'm talking about here is car crashes and falls and violence and suicide and overdoses and poisonings, everything we think is never going to happen to us, but sometimes it's too late. And the cost is outrageous. It's $4.9 trillion annually, and that's over 17% of our GDP. So there were a few people who, again, thought that these were preventable things, and those were our pioneers. They came together on the Institute of Medicine committee that convinced Congress to fund the Injury Center, initially with $10 million. And the chair was Bill Foege, who was a director of CDC and helped eradicate smallpox. And the vice chair was Sue Baker, and she's a Hopkins professor who's known as the mother of injury prevention. And she founded the Injury Center at Hopkins, and that's supported by CDC.
The Injury Center is the epitome of shoe leather epidemiology, this idea of experiencing something for yourself. Sue's really big on this, and she earned her pilot's license, she drove an 18-wheeler, and she spent a week on an aircraft carrier in the name of science. It's why they called her Fearless Baker, and it's also why her fingerprints are all over the safety we have around us today. So she's got this over 60-year legacy, but it's being burned down, and we have to save it quite literally to save ourselves. Sue fortunately raised a whole army of injury prevention folks, and that includes the current and former deans of the Johns Hopkins Bloomberg School of Public Health. And they all shaped the field. CDC scaled it. You actually had a guest talk about this, Deb Howry. She's the former CDC chief medical officer, and she also ran the Injury Center. And she said that the Injury Center is really the boots on the ground scientists and that it's the little engine that could. That's what makes it more than the sum of its parts. It applies lessons from one area of injury prevention to another, and so it cross-pollinates. And that's how we get ahead of trends that could otherwise kill us. So just as an example, it sounded the early alarm bells on the opioid crisis. And another thing that makes it really unique is it's the only place that is the connective tissue binding and powering state health departments. That's how we avoid recreating the wheel, and that's how we respond to urgent needs. And the center's work reverberates globally. So important because injuries are 3 of the top 5 causes of death for young people ages 5 to 29 around the world. And those causes of death are road traffic injuries, suicide, and homicide. So it's this global anchor with ripple effects.
What exactly is injury prevention?
The best way to think about injury prevention is to look at the room that you're in. So, Stephanie, we're on video, and I see that you have a smoke detector behind you, and you've got windows around you. I would bet that they're probably shatterproof. They might be tempered glass, maybe not. And you've got outlets, electrical outlets that are grounded, right? In your office, you probably have a sprinkler, or if you were an apartment building, you'd have a sprinkler too. And so these are the invisible protections that exist because the government required it, and we just came to expect it. But there's growing distrust of the government and especially of CDC. So there's this real disconnect between what we rely on every single day to keep us safe and alive and the dismantling of an institution that mandates these things.
So, what is going on with the CDC Center?
Okay, there's good news and there's bad news. The president did propose eliminating the injury center, but the Senate and the House rejected that. They did, however, propose different funding levels of the center. So the Senate continues funding at $761 million. What's interesting is the president actually wanted to preserve one specific system that monitors trends around violent deaths like homicides and suicides. It's called the National Violent Death Reporting System, or NVDRS. But the House rejected his attempt to preserve that. And this really tells us that we need to message better around its importance. There's also bad news. Listen, whatever happens next, we are already feeling the pain. And I know that there's a lot of listeners out there who have lost their jobs. And I am so very sorry for all of you. And sadly, I recognize that there might be more. And the consequences of this are really horrific. Right now, fortunately, there's still staff at CDC working on opioids and suicide and adverse childhood experiences, but there's nobody working on crashes and drowning and older adult falls and traumatic brain injuries and lots of forms of violence like child abuse and neglect and intimate partner violence. And because of the shutdown and the reductions in force or the RIFs, there's a lot of people gone, like the policy and communications folks. The suicide team was briefly eliminated and then reinstated. And the money's still there, right? But there's nobody home. The rug has really been pulled out from under CDC and as a result, Americans.
I want to ask you sort of what the consequences of that could be, but I also want, if you can give me a big picture of injuries, how many people are impacted each year?
Americans go to the doctor 57.7 million times a year because of injuries. And injuries land us in the emergency room 43.5 million times a year, too. Over 300,000 people die annually from injuries. And those numbers might seem high, but they've actually been cut in half thanks to the institutionalization of injury prevention.
So you mentioned road injuries. We have a large proportion of road injuries in this country that has not been addressed. And now those people are gone, the people who are trying to solve that?
That's correct. And that is terrifying. Now, I will say I work for the FIA Foundation, and we're a global philanthropy that focuses on safe and sustainable mobility. And most of our work is focused on low and middle income countries. That's where 90% of road traffic fatalities occur. But the US is the high income country with the highest road traffic fatality rate. And that is why it is appalling that there's nobody at CDC right now working on this. Now, I mentioned Sue Baker, and one of her main focuses was road traffic injuries and continues to be. More kids over age 5 die on our roads than from anything else. And the key to prevention on that is to collect and analyze data quickly. That's what CDC does. They are the shoe leather epidemiology that gets down to the ground. They're the boots on the ground, and they help communities address this pandemic on wheels. It's the antithesis of federal bloat, right? Over 80% of their funds go back to communities. What they do is they reduce data lags by 98% through emergency department data on road traffic crashes. Otherwise, the data that we use is usually about 3 years old, but CDC uses data from 3 weeks ago. And so without those people at CDC, we risk having about 50% of pedestrian and cyclist crash injuries go undetected.
What's the consequence of that?
Well, if we don't know how people are dying on our roads and where they're dying on our roads, we can't prevent that from happening.
And how do we prevent it?
Sure. So there's lots of ways to prevent road traffic crashes. And let me just say that every single fatality or serious injury is preventable. We are humans, we make mistakes on roads, and those mistakes should not be death sentences. The main way is to reduce speeds. And the USDOT did have and continues, fortunately, to have an evidence based approach to reducing speeds. It's called the Safe Streets and Roads for All program, and it goes back to communities to help them implement something we call the safe systems approach to save lives on roads. I should say, though, one thing, just more practically speaking, beyond crash prevention, is that CDC did things like it would help you navigate buying a car seat. They took the guesswork out of it. Now, my kids are 3 and 6. I work in this field. I find it really hard to know when they need to move out of one car seat to another. And is it weight? Is it height? It's complicated. But CDC took the guesswork out of that. They work with Target and other stores to provide resources on this to help parents like me figure out how to keep their kids safe. And the ROI is really significant. For every $57 spent on child safety seat distribution, you get over $2,400 in savings. So injury prevention not only saves lives, it saves money.
I wanted to ask about children because it feels like a lot of these sorts of things happen to children. Are children less safe if we don't have a robust injury center?
Yes, 100%. A great example, unfortunately, is traumatic brain injuries. So if you've got a young soccer player at home and the coach says, no headers, or if you've got a football player who's wearing a quality helmet, all of those prevention mechanisms are founded in science, and specifically the Injury Center and the 13 other university centers that work with it, the first of which Sue founded at Hopkins. And states rely on CDC to train millions of coaches on prevention and treatment and the management of traumatic brain injuries. It's called their Heads Up program. And that training is mandated for all school coaches, but now it's unclear how they're going to meet state requirements without CDC's training and resources. The science evolves, right? CDC Injury Center has been updating clinical guidelines for treatment and management of pediatric traumatic brain injuries. And so when a kid goes to the doctor for a concussion or a head injury, the doctor has the most up-to-date treatment guidance. But again, the workforce at the Injury Center that was supporting this is gone. And the stakes are really high. There's over 2.5 million medically treated traumatic brain injuries per year. And if that work ends, it will undoubtedly affect and harm kids across the U.S. There's also drowning. Their drowning team is also gone. The leading cause of death among children ages 1 to 4 is drowning, and CDC was the only federal agency that was collecting data on drowning deaths and guiding the work of the American Cross and the YMCA. The rates are really high on drowning in low-income areas, but the cost-benefit ratio, again, is strong because each life lost to drowning costs about $11 million. I hate to put a number on it, but that's what we have to do. And one 8-lesson session of swimming and water safety that CDC was supporting costs about just $110 per person, but reduces the risk of drowning. So these gaps are enormous, and we are quite literally falling through them.
What you're talking about are a lot of things that we don't notice. We don't notice that our coaches are being coached on how to prevent head injury. It's this invisible stuff going on behind the scenes. What other things might we be losing?
Another one is fall prevention. So if you are over 65 and you go to the doctor, they're going to talk to you about fall prevention. And thanks to the Injury Center, this was the only agency bridging the gap between science and prevention on falls. They're the leading cause of injury-related death among adults over age 65, and the death rate is increasing. The cost, again, is outrageous. It's $80 million in healthcare expenditures annually, and Medicare alone pays about 2/3 of that cost. And I see this as a loss to taxpayers. We expect that our tax dollars are funding systems that keep us safe, but they're not anymore. And again, with these gaps in data, we're going to fall through. The center is the core puzzle piece of the safety that we take for granted. And jeopardizing that means you're not just cutting off an arm of CDC, you're actually cutting off the same arm in every single state. Because injury prevention is invisible, it's essential, and it's nonpartisan. And if we let it die, we may die with it.
There's a lot of doom and gloom here. What can be done from here?
When you're done listening to this podcast, please go back to your phone and call your elected official. Urge them to support the funding levels in the Senate bill, the one that continues the current funding for the Injury Center. They have to listen to you. That's how they count on your vote. And Safe States is a fantastic nonprofit that has a good resource that makes it really easy. It's called the Keep America Safe Coalition. It's keepamericasafe.info. Look, this is not the first or the last time that an institution that we have the luxury of taking for granted is going to be attacked. And Sue Baker likes to remind me that she did not create the field of injury prevention by herself. And what that means is it's going to take many of us, in fact, all of us, to save it. So we need to stay vigilant and vocal and remember that our votes count.
Natalie Draisin, thanks so much for joining me.
Thank you so much for having me, Stephanie, and for everything that you do.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmon. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.